Good evening, everyone, and welcome to OET Listening Prowess. This is me, Shaji, joining you from 𝐻𝐿 Academy. Yes, we've come with yet another OET Listening Live, and I hope you're all doing good. So, how is your preparation going? Are you all practicing your listening? Like I always say, the only thing that you need to be careful when it comes to your listening practice is that you don't take a break in between. This is even important for your reading, writing, and speaking, but I mean, it is very important in any language preparation or language practice. But listening is something which you have to give a little more importance when it comes to OET and when it comes to consistency. Okay, in OET, consistency is a little more important in listening, I would say, because if you take a break, you would see that difference the next day, the very next day. So even today in the class, I was telling my students, you are all doing good. Just make sure you keep practicing till you go for your exam. That is very important. Yes, you're all joining. I'm so happy to see that you're all joining. Yes. So make sure you're consistently practicing. And it's not just that you're practicing consistently, it's also that you're looking at where where you're actually making mistakes, and you're also focusing on how to correct them. That is very important. So you should observe the marks that you're getting. Okay, imagine if it's below 30, what you will do. You will see which part was the toughest and why did you score less in that, or in which part or in which extract did you score the least, and what was the reason for it. Sometimes it could be because the in that audio that part was very difficult. That could be one of the reasons. Another reason could be that you're constantly making mistakes in that part. I had a student who was telling me that she's always making mistakes in her part A. And she is pretty good at her part B and part C. So she could observe what was causing a problem. What was the reason behind her scoring really less? And when you say that you're not able to score really well in your part A, that means you're going to lose a lot of marks. We have almost 24 questions, not almost, we do have 24 questions in part A. Extract 1, 12 questions, and extract 2, 12 questions. So if you're losing a lot of marks there, that means you are losing, if you compare the percentage, if you take the percentage, you are losing a really good number of marks there. So if you're making too many mistakes in part A, it's important that you identify it. So how do we learn? How do we improve our OET listening or OET reading or writing or speaking, whatever that is? Identifying our weakness, identifying where we're always making mistakes. That is very important. So the reason why she was making, so we were analyzing the reason why she was making mistakes. So when we observed her answers, what we could find was that her answers are all good. She's doing pretty well in part B and C. That means her listening skill is really good. She's able to identify, she's able to understand, and especially she's really good at understanding the overall meaning of something and writing the answers. She's good at that. She's able to score more marks in part B and C, because in part B and C, all that you have to do is darken the circles for part B and C. You don't have to write anything. This student is actually weak in her spellings. That was the reason why she was scoring really low marks in part A. So imagine when she was getting low scores, she had focused on just improving her listening skill and not doing anything with her spelling. She wouldn't see any improvement. All that she would end up with would be disappointment. She would be disappointed at the end because she's focusing on her listening skill, which she is pretty good at. It's not the problem with her listening skill. It was the problem with her not understanding or with her making spelling mistakes. So she had to focus on that. And that's how you improve yourself. So every time you make mistakes, don't come to an assumption, okay, this is the reason, but just clearly find. You can seek the help of your trainers to find what is actually causing the problem. And then you can focus on that part and improve. Yes, Dahlia Roldan. Hi, good evening. Good evening, everyone. Good evening. Yes, Dahlia, I think you're new here. I haven't seen you here before, so I think you're new here. Um, Yes, we are seeing new people in every live, and I know people who are regular viewers, and I can identify them. But when new people come, it's always a joy, and it's always beautiful to see you all here. Okay, so we were talking about identifying the mistakes in the audio. Sorry, not in the audio, in the answers that you're writing, or the whole process, or identifying the mistakes that you're making. All right, and then working on it. So a lot of students ask me and tell me that, oh, Hannah, I'm so bad at spelling. I don't get or write the right spelling. I make a lot of spelling mistakes, and when I make spelling mistakes, those answers become wrong. What do I do? Yes. Yes, Lynette. Hi, Lynette, Anila, George. Good evening. Do we have daily listening classes? Yes, we do have regular classes. We're providing classes for OET, IELTS, and PT, and German, and everything. And we're starting our offline as well. We have online and offline classes. So if you want to know more about it, you can contact. If you meant live classes, like live sessions like this, OET listening prowess, the live session specially assigned for OET listening, would be only on every Wednesday at 8 p.m. So that's when we come with OET listening free live classes through Facebook, and that will be always that would be aired on our Needus Academy page on Wednesday at 8 p.m. Otherwise, regular live classes we're providing that as well. You can contact the details provided in the comments, and they'll in the number provided in the comments, and they'll give you more details about our online and offline classes. I hope that helps. Okay. So in OET Live Listening Prowess, the free sessions that we're providing through Facebook and YouTube as well, this is available on YouTube as well. What we do is we're providing one part. Like if we're taking part A, we'll be taking part A extract 1. We'll be giving an audio, and we will be giving we'll be giving you the time to write the answers. And once you write the answers, we'll be discussing the answers with the help of audio script. Audio script helps you get the complete idea about that audio. Like each and every word in that audio will be given in that audio script, and with that we'll be discussing the answers, and in that audio script we will also be underlining and marking the answers. Yes, Riga Mary. Hi, Zabi Fazil. Good evening. I'm good. I'm good. I'm doing fantastic. How are you all doing? I'm seeing a lot of new faces here. I'm so happy to see you all here. Yes, so that's how our OET Listening Prowess Lives go, and we are not providing the same materials that we provide in the classes. These are all fresh materials. These are all new materials that we're providing in our OET Listening Prowess. So even if you are a student of Needus or not, you can be benefited from the lives that we're providing. Yes, and in this, today what we're doing is we had started off with a material, and we had done its part A extract 1, extract 2, then part B, part C extract 1, and today we will be doing part C extract 2, the final part, the final extract or the final part of this material. And I have 6 questions in it. If you ask me if it's easy, I would say it's a bit tricky. The answers are not direct. We have some kind of part B and part C questions where the answers will be directly given. For example, I've pain in my hands and legs. So the question would be like, where does the patient have pain? Option A, hands and legs. Option B, belly. Option C, neck and head. Like these kind of options. So you can directly write hands and legs. That's very easy. The answer is directly given. So those kind of part B and part C are very easy. Other ones would be, the other types are the ones where you have to derive the answers. Okay, when they say this, you have to understand. They might give you 3-4 sentences explanation. From that, you have to find out which one is the answer. You have to derive the answers. Yes, Zabi Fazil, I hope I'm pronouncing your name right. If not, I'm sorry. Classes are very helpful and easy understanding. Thank you very much. Oh, thank you. Thank you for your feedback. That is really beautiful. And I really appreciate your effort in typing in such beautiful comments for us. Thank you so much, and I'm wishing you all the very best for your OET preparation. Come out with flying colors and make us all proud. Okay, and I'm sure you guys will, because every time I see students in the live, I tell them, I'm sure you guys will make. Why? Because you might have a lot of things to do during a day. You'll have a lot of works to do. You might be even taking regular classes. And if in between you're finding time for a live session where you're getting some online materials, where you're getting some audios and listening materials, and if you're putting that effort, that shows your hard work. That shows your determination towards achieving your dreams. So, and I totally appreciate it, and I always tell in my lives that it feels great to work with people who are working towards their dreams, and it is indeed a pleasure. Yes, so happy to see you all. Jansi Gigi, yes, good evening, good evening. Vidya Varun, hi Vidya. Yes, I hope you're all doing good. You guys are indeed spreading so much positivity and joy and happiness to all of us, because we're so happy to see your comments, and because it's all about, it also tells about the effort you're putting in to, and the time you're taking to type in such beautiful comments about us. Yes, Zabi is saying, I want to join the next batch of OET so I can achieve my Sabri. You will, for sure, you will be able to. Let this be a beautiful beginning for you and all the other students who are watching and who are new here. I can assure you that it's a beautiful decision, and it is going to be a beautiful step. But always remember, it is also about you working towards it. It's about you putting in the effort, and we will always be there with you throughout the journey. And that is a word we give to all our students, and we always keep it. All right, yes. So now let's get to our business. Today we are doing our Part C, Extract 2. I told you already. So we have 6 questions. We'll be doing 6 questions. So since I'm seeing some new students here, so what I'm seeing, since I'm seeing some new students here, you know the drill. I hope you know it. Part C, you have 6. Extract 2, you'll have 6 questions. Extract 1 also, you have 6 questions. You'll be given 90 seconds to read the questions. During that time, read the questions carefully, and you have to read the questions really quick, because 90 seconds would be soon over. So you now, I don't think you will have the possibility of underlining the keywords, but you should keep in your mind those are the keywords. Or if you have a possibility of underlining the keywords, make sure you underline the keywords. So you have 2 methods of reading the questions. One is reading the question and the options together, that way, the usual way. Another one is reading the questions alone, and then later coming back to the options and reading them. So that even if the 90 seconds is over before you completed reading all the 6 questions, you have at least read the questions. So now it's just that for the last 2 questions you don't know about the options. That's fine. But in the other method, where you're reading the questions and the options together, what can happen is, if the time is over before if the time was over before you finished reading all the 6 questions, then by like when you reached question number 34, the time was over. Then what you will have to do, you'll have to listen to the audio, write the answers for all the 6 questions, but you have not read your last 2 questions. You don't even have a a bit of idea about it. You don't even have any idea about it. So it's going to be difficult, but you can go for the method that works best for you. So I've said this in the previous lives as well. I'm repeating it so that those of you who are new here will also be able to answer these questions. So just try to listen, and this is a tricky one. So even if you're not able to do it, fine. Just don't be disappointed. It's a bit difficult one. So some questions are really kind of tricky, but give it a try. And when we discuss the answers, it would be really clear to you. And if you're finding it really hard, don't worry. Right after the audio is played, I will be giving a detailed explanation about why that option became the answer and why other options did not become the answer, and everything would be explained in details. And any difficult words in it will be explained as well. Okay, so yes, now without wasting much time, let's go to the audio. The audio will be played and the questions will be shown on the screen now.
Part C, questions 31 to 42. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Now, look at extract 1, questions 31 to 36.
You hear an interview with an optometrist called Henry Chapman, who's talking about the impact of macular degeneration. You now have 90 seconds to read the questions.
We are talking today with Henry Chapman, an optometrist with a special interest in macular degeneration. Mr. Chapman, firstly, what is macular degeneration and how did your particular interest in this disease come about?
Macular degeneration is actually the name given to a group of chronic degenerative retinal eye diseases that cause a distortion or progressive loss of a person's central vision, but leaves the peripheral or side vision intact. Say, if someone with macular degeneration was facing me now, they'd see my arms and legs, the area around me, but my face would likely be obscured by a dark or empty space. They experience a dreadful sense of being disconnected or cut off from everyday life. As an optometrist for 30 years, I've had my share of cases, and every new patient is like a spark because the impact of each accumulates over time to a kind of, almost what you call a fixation, I guess. Even after all these years, however, I was still shocked to hear my sister had recently been diagnosed with macular degeneration, and because of that, I've now also seen firsthand what this terrible disease does to the entire family.
What's the most challenging part for those living with macular degeneration?
Take a recent patient of mine called Robert. He was 55 when he first noticed the symptoms: blurred vision, distortion of straight lines. The effect on his life was profound, And that's the tragedy of this disease. He was working as a driving instructor, then suddenly had to resign, but still with the financial burdens of daily life. His passion for carpentry or even basic reading fell by the wayside. Worst of all for Robert was no longer being able to see his grandchildren's faces clearly, which was obviously very upsetting. Unfortunately, he also experienced depression for a time. This may not happen to everyone, but it's certainly more common than people realize.
What can be done for patients such as Robert?
This is a disease that's typically related to aging, which is the commonest risk factor, but it's certainly not a normal or inevitable consequence of getting old. So although older people are generally more accepting of the extra baggage that comes with aging, it's still difficult for many to accept and discuss the changes associated with macular degeneration. There's a tragedy attached to any disease or illness, but vision loss also carries some major disruptions to a person's lifestyle, as well as mental hurdles, like few other diseases do. I feel that's something that can at times be neglected. There are support groups, but I'm talking on an optometrist level. My job is to help diagnose and treat a patient. But what of their additional struggles? That's where I'd like to place myself a little better and allow patients like Robert the freedom and availability to open up.
And do patients ever volunteer to express their fears or frustrations to you directly?
They do, but in the beginning what I see is their brave face. They often say, "There's always someone worse off." And that's an admirable trait, but reality soon rears its ugly head. Because macular degeneration doesn't result in total blindness, sufferers are left with partial vision, and I suspect that many patients may genuinely interpret this as being somehow less significant than total blindness, like they don't have the right to speak out. The reality is, of course, that sufferers of macular degeneration have many of the same fears and impediments as those who've completely lost their sight, and yet they're worried about voicing this. So it's imperative that we not only actively listen, but also encourage and support them to openly share their stories.
Can you give us an example of how you've changed the way you treat your own patients?
Sure. I have a patient called Jennifer. She's 62 and has late-stage neovascular or wet macular degeneration. This is caused by the formation of very fragile blood vessels which leak fluid and blood within and under the retina. It also leads to a rapid loss of central vision as opposed to the dry kind, which is a far slower decline. Therefore, it came as a great shock for Jennifer, in turn making her a perfect prototype, if you will, in trying something new. I allocated just an additional 10 minutes to each of her appointments and explained it was for an open discussion. This extra time gave me the opportunity to delve a little deeper into how she was coping with the rapid changes she was experiencing and gave her more freedom to discuss her concerns. The positive change in communication was extraordinary, so I adopted this for all my patients thereafter.
So what, if anything, can be done to help prevent macular degeneration?
Research is ongoing and advancements in treatment are being made daily, and this needs to continue. But you can't leave it up to researchers. I believe in what the individual can do. This means that any difficulty with vision should never be dismissed as part of aging. In its early stages, macular degeneration may not result in noticeable visual symptoms, but it can be detected with an eye test. If people want to save their sight, I can't stress enough how crucial the early detection of any form of macular degeneration is. The sooner that this disease is detected, the earlier that steps can be taken to help slow its progression and save sight through treatment and necessary lifestyle modification.
Screenshot of this, take a screenshot of this and keep it with you so that when I discuss the answers, it would be easy for you to refer those questions. Okay, it would be always great if you can do that. Okay, so we'll start with the discussion. Okay, if you want, you can take a screenshot now, or you can copy them down. Copying them down would take some time, so if you're really quick at copying it down, you can do that as well. Okay, on your book, you can copy it down to your book that you've kept aside for your listening. I always say that you need to have a book for your listening. For each subtest, you need to have a book. All right, so let's look at the first question. Question number 37. Rebecca says that a challenge that many healthcare providers face with overweight patients is. So you're looking at the challenge. Option A, establishing a strong relationship. Option B, balancing aspects of communication. Option C, timing their discussions effectively. Okay, let's see. Let's look at the audio. You hear a clinical dietitian called Rebecca Hudson giving a presentation to a group of healthcare providers. You now have 90 seconds to read the questions. My name is Rebecca Hudson. And I'm a clinical dietitian working here in the hospital. Today, I'll be presenting what some consider a very challenging topic, raising the issue of weight loss and obesity with patients. Okay, so she's going to present some a topic that some consider challenging. Okay, she's going to present something challenging. So what is our question? The challenge many healthcare providers face with overweight patients. What is the challenge they face? So here they're using the word challenge, but they're not saying that is the challenge these healthcare providers are facing with the overweight patients. So you can't take that as your answer. A person's weight is a complex and sensitive issue. Many factors are at play, like concerns about being judged. You heard 31 to 36. So you're talking about to a group of healthy. You now have 90 seconds to read the question. So Vidya, what was your concern? You heard 31 to 36. Oh, you all listened to extract 1? Okay. You listened to a different audio? You didn't listen to Rebecca's audio? Okay. 1 second. Okay. 1 second, let me see. So you didn't hear this, right? Okay. Okay, 1 second. I'll fix it now and okay, so I'll play the audio for this material. That was okay, so I think there was a technical error. Let me try. So, okay, so we'll play the audio that belongs to this material because the
Clinical
optometrist
dietitian called Rebecca Hudson giving a presentation to a group of health.
Rebecca, that was a technical error. So I'll play that audio for you now. Just try to do this, okay? This material as well. Okay? Yes.
Clinical dietitian called Rebecca Hudson giving a presentation to a group of healthcare providers. You now have 90 seconds to read the questions.
My name's Rebecca Hudson, and I'm a clinical dietitian working here in the hospital. Today I'll be presenting what some consider a very challenging topic, raising the issue of weight loss and obesity with patients. A person's weight is a complex and sensitive issue. Many factors are at play, like concerns about being judged, feelings of embarrassment, or even failure. As a dietitian, I see this on a daily basis, yet beginning discussions about weight can still be unsettling for both myself and the patient, who often knows it's coming. This is because, as healthcare providers, we're sometimes uncertain of how to discuss weight-related issues while still providing support to our patients in ways that are empowering and non-judgmental. During the consultation, we strive to get our message across, but if we lack the initial training to do so, chances are we'll lose trust and irrevocably damage the provider-patient relationship that's so vital. We risk stigmatizing or even shaming our patients to the detriment of treatment goals and inevitably patient outcomes. So how is effective communication achieved for sensitive matters? Often a healthcare provider's comments as they open the channels of dialogue with the patient are the most important. A patient's level of comfort in discussing their weight needs to be established. Asking directly if they're okay talking about their general health and weight is the most efficient way to do this. Once the conversation is moving, I've personally found that tactfully choosing terms like excess body weight or above ideal body weight far easier on the ear than excess fat or obese. This practice is very important in establishing trust. One method I've found very useful during this time is not referring to them as the condition. It's common these days to hear that a patient has diabetes rather than is diabetic. This crosses over to has obesity rather than is obese. The next step in maintaining dialogue with the patient is by way of open-ended questions and ensuring we articulate them the way they're intended. This is achieved by first eradicating all implicit assumptions and bias about obesity to ensure that we don't give patients a feeling of being judged. Let me give you an example. The basic questions used by dietitians are based upon 3 of the main factors that influence a person's weight: their eating, drinking, and exercise patterns, as well as their previous attempts at weight loss. If I say, I think you need to lose weight, this is my opinion, a judgment. Now consider an alternative like, are you interested in losing some weight? This suggests that you're likely sympathetic to any past attempts, that you're willing to provide them with support across the board, and it allows the patient to begin the conversation without feeling judged or criticized. There are of course occasions when consultations don't go as planned, even after your support has been well established. I'm a strong believer, as are many of my colleagues, in relating a patient's weight to their current medical condition, whether it's diabetes, heart disease, osteoarthritis of the knee, or disease of the eye. Regardless of the condition, the general health of the patient is paramount. This is a technique that, when employed with tact, will prove a very persuasive one, as often obesity is considered a separate issue. So, when it's seen as a contributing factor, and therefore one that, if brought under control, may reduce symptoms such as chronic pain, the effort needed to make the change soon appears less significant. Education and ongoing support for the patient will reinforce a healthcare provider's advice and recommendations. This can be as simple as providing patient fact sheets and brochures about their current condition, as well as the benefits of weight management. My personal recommendation is to carefully select 2 or 3 measurable, achievable goals and discuss the steps necessary to reach them. This is also a valuable time for the healthcare provider to evaluate the patient's readiness to make the necessary lifestyle changes to lose weight, as well as the extent of familial support, the latter often being a key element of success. All that I've mentioned here today are examples of what dietitians refer to as motivational interviewing. This is an open-ended way of interacting, built around helping patients go from being disinterested in or against a behavior change to taking steps toward being willing to make some changes. It is an open-ended approach to trying to learn where the patient is coming from and what they want, and helping them lead the way towards positive behavioral changes. It starts with trying to get the patient to open up about their feelings, rather than assuming we know who they are, and then together coming up with a set of initial steps they can take. We need to engage the patient, and then the patient activates the behavior.
Okay, so I hope you answered your extract 2 as well. And those of you who did your extract 1, that is question number 31 to 36, it's okay. That's not a loss for you. The explanation and audio script is available on our page. Okay, so you don't have to worry about it. You can you can go to Neetu's Academy YouTube channel or this Neetu's Academy Facebook page here itself. Last week, the week before last week, we have actually added the explanation for that as well. Okay, so you can refer that if you were not there in that live. Okay, and so now 37 to 42, let's look at the questions quickly. So I'll read question number 37. Rebecca says that a challenge many healthcare providers face with overweight patients is option A, establishing a strong relationship, option B, balancing aspects of communication, option C, timing their discussions effectively. So we read the initial part. My name is Rebecca Hudson. I'm a clinical dietitian working here in the hospital. Today I'll be presenting what some consider a very challenging topic. So I said she's talking about the challenging topic, but the question is, what is the challenge that healthcare providers are facing? Okay, when they're dealing with overweight patients. Okay, raising the issue of weight loss and obesity with patients. A person's weight is a complex and sensitive issue. Many factors are at play, like concerns about being judged, feelings of embarrassment, or even failure. As a dietitian, I see this on a daily basis. Yet, beginning discussions about weight can still be unsettling for both me and the patient, who often knows it's coming. This is because as healthcare providers, we're sometimes uncertain of how to discuss weight-related issues. We are uncertain how to discuss weight-related issues while still providing support to our patients in ways that are empowering and non-judgmental. So they want to discuss the weight-related issues. At the same time, they want to provide support in a way that at the same time, what they don't want to be judgmental, they want to be empowering. So you can type in your answers in the comments. Okay, which option do you think is the answer? So is the challenge to establish a strong relationship? No. So then balancing aspects of communication. Yes, balancing aspects of communication. They want to express the weight-related issues. At the same time, they want to support them. And at the same time, they want to be empowering and non-judgmental. So they're finding it hard to balance aspects of communication. So option B is your answer. Option C, timing their discussions effectively. We cannot see them talking about timing their discussions or anything related to that. So option C is eliminated. Okay, so option B is your answer. 37, option B is your answer. Okay, those of you who got option B as your answer, please comment. Okay, yes. Now, for when you know that when part C is a presentation, you have something called signposting language. That helps you understand. Then moving on to the next question. So here the answer is not over. You have some more audio for question number 37. During the consultation, we strive to get our message across. But if we lack the initial training to do so, chances are we'll lose trust and irrevocably damage the provider-patient relationship that's so vital. What is the meaning of irrevocably not able to be changed, reversed, or recovered? That means final. Damage, so we risk stigmatizing or even shaming our patients to the detriment of treatment. Okay, we risk shaming them or stigmatizing to the point where it would affect the treatment goals negatively and inevitably patient outcomes and unavoidably even affecting the patient outcomes. Okay, is that part clear? Now we'll look at next question, and if we find the keywords there, then we understand they're moving on to next question. So what is the next question? Next question is question number 38. Rebecca believes that demonstrating sensitivity when discussing weight is option A, established from the outset of the consultation. So this is about sensitivity when discussing weight. So when do you demonstrate sensitivity when discussing weight? Option A is established from the outset of consultation. Option B, sometimes misunderstood by healthcare providers. Option C, directing language away from the term obesity. So let's see. So how is effective communication achieved for sensitive matters? So they're going to talk about sensitivity. Often a healthcare provider's comments as they open the channels of dialogue with the patient are most important. So a healthcare provider's comments when they open the channels of dialogue, so when they start. So the sensitivity starts where? With the outset of the consultation. So before even when they open the channels of dialogue, that's where they have to be sensitive. I don't see any comments here. Write down the answers here in the comments. So with the patient are the most important. So that is the most important. So definitely we can, with that sentence itself, we can match it with option A, established from the outset of consultation. Outside the consultation, that's how it is established. A patient's level of comfort in discussing their weight needs to be established. Asking directly if they are okay talking about their general health and weight is the most efficient way to do this. So before even they started, they have to discuss these things. So the sensitivity starts established from the outset of consultation, from the outset of the consultation itself, it is established. Okay, once the conversation is moving, I've personally found that tactfully. So this is after the conversation is going on. Then they tactfully choosing terms like excess body weight or above ideal weight is far easier on than the ear. That means it is more okay than excess fat or obese. This practice is very important in establishing trust. So option C, directing language away from the term obesity, that is not the most important. The most important thing they're saying is sensitivity is established from the outsets of consultation. So option A is the answer. Option C is eliminated and misunderstood by the healthcare providers. They're not talking about it, so we're eliminating that as well. Question number 39. Okay, let's see question number 39. Rebecca suggests that asking open-ended questions, option A, helps eliminate any personal prejudice. Option B, covers many barriers with a single sentence. Okay. Option C is the ideal way to begin the consultation. So open-ended questions. Let's see what that is. One method I have found very useful during this time is not referring to them as the condition. It's common these days to hear that a patient has diabetes rather than is diabetic. This crosses over to has obesity rather than is obese. The next step in maintaining dialogue with the patient is by way of open-ended questions. This, you got the key word. You know they're talking about question number 38. And ensuring we articulate them the way they're intended. This is achieved by first eradicating all implicit means suggested, not directly expressed, assumptions and bias about obesity to ensure that we don't give patients a feeling of being judged. Okay, let me give you an example. The basic questions used by dietitians are based upon 3 of the main factors that influence a person's weight. Okay, their eating, drinking, and exercise patterns, as well as their previous attempts at weight loss. If I say, I think you need to lose weight, this is my opinion, a judgment. Now consider an alternative, like, are you interested in losing some weight? This suggests that you're likely sympathetic. So are you interested in losing some weight? That could be considered as an open question because that you give more information. Okay, this suggests that you're likely sympathetic to any past attempts, that you're willing to provide them with support across. So this is conveying so many things. Okay, this is saying that you're sympathetic to any past attempts, you're willing to provide them with support across the board, and it allows the patient to begin the conversation without feeling judged or criticized. So that means it matches with, they're not talking about it helps eliminate any personal prejudice. They're not talking about that point, so we're eliminating option A. Then we have option C. Option C is the ideal way to begin a consultation. No way we can see that. This is the ideal way to begin a consultation, so we're eliminating that. Option B, they're saying, covers many barriers with a single sentence. Covers many barriers with single sentence. So it is able to cover a lot of problems in single sentence, obstacles in single sentence, like sympathetic, providing support, and begin the conversation. So all these things are over. It is not judgmental, nothing. You're just asking a question, so it's done. So option B is the answer. Question number 39, option B is the answer. I don't see your answers here. What happened? Or is it that I'm not able to see the comments? I'm not sure about it. Yes, question number 40. When consultations prove difficult, Rebecca suggests option A, focusing on the patient's general health rather than obesity. Option B, convincing the patient that support is never out of reach. Option C, changing the way the patient views the weight problem. So when the consultation, so we're looking at the, one second. One second. Okay. So, yeah. There are, of course, occasions. Question number 39 is option B. 39B. Anila, 39 answer is B. Okay, 39B covers the barriers with a single sentence, because with single sentence they're talking about sympathy, they're avoiding prejudice, they're covering a lot of problems with that question. Okay, that is what they're saying. Now, next one, signposting. Let's look at the signposting. There are, of course, occasions when consultations don't go as planned, even after your support has been well established. So if you look at question number 40, we can see that when consultations prove difficult, when consultations don't go as established, what is happening? Look at the highlighted portion. As often, obesity is considered a separate issue. Often it is considered a separate issue. So when it's seen as a contributing factor, okay, when it is considered as a contributing factor, and therefore one that, if brought under control, may reduce symptoms such as chronic pain, the effort needed to make the change soon appears less significant. That information actually matches with option C. When this problem, weight loss consultations, that become difficult, you can change the way patient views their weight problem. You can tell them this is the contributing factor. This is the reason for you getting this pain. Okay, so if you keep this under control, then things are going to be all right. So this would reduce that. The way the patient approaches the weight is different. Okay, this would reduce the effort needed to make the change. Okay, so option C is your answer. Option B, they're not talking about it, convincing the patient that support is never out of reach. Option A, focusing on the patient's general health rather than obesity. They're not mentioning that, so we're eliminating that is not what they're talking about, so we're eliminating those two options, and option C is your answer. So 40C. Now look at question number 41. Rebecca thinks that a patient's continuing education should include, option A, should include a small number of obtainable objectives. Yes, 40C, correct answer. Riga 39B is correct, or 40C is correct. 41, Rebecca thinks that the patient's continuing education, option A, should include a small number of obtainable objectives. Option B can present new demands for the healthcare provider. Option C must include the family in order to be successful. So let's look at the signposting. Education and ongoing support for the patient will reinforce. So they're talking about education. Okay, reinforce means strengthen or support a healthcare provider's advice and recommendations. So look at the highlighted portion. My personal recommendation is to carefully, so what is she saying? So Rebecca thinks continuing education, what she's saying, recommendation is carefully select 2 or 3 measurable, achievable goals and discuss the steps necessary to reach them. So this education should include what? Number of small obtainable objectives. Small number of obtainable objectives. So option A is the answer. Then you might have a confusion with option C, because they're also talking about familial support. But look at this. This is also a valuable time for healthcare provider to evaluate the patient's readiness to make the necessary lifestyle changes. This is a valuable time for what? The healthcare to decide if they are ready to make the lifestyle changes to lose weight, as well as the extent of familial support, the latter often being a key element of success. Okay, so they're saying a healthcare provider can evaluate the familial support. That is often being a key element of success, but they're not saying it must be included, familial support, in order to be successful. They're not saying it is a key element and this has to be evaluated. That's what they're saying. So that is not what the question is asking you about. Option C is eliminated. Option A is your answer. Now let's look at question number 42. According to Rebecca, motivational interviewing is about the healthcare provider. Option A, utilizing well-established practices in patient contact. Option B, taking charge of the changes to a patient's behavior. Option C, understanding the patient's individual situation. So let's look at the signposting. All that I've mentioned here today are examples of what dietitians refer to as motivational interviewing. So motivational interviewing is the key word. We're seeing that. Now we're looking at the highlighted portion. It is an open-ended approach to trying to learn where the patient is coming from. So what are they saying? According to Rebecca, motivational interviewing is about the healthcare provider. What is the healthcare provider doing? It is an open-ended approach to trying to learn where the patient is coming from and what they want, and helping them lead the way toward positive behavioral changes. It starts with trying to get the patient to open up about their feelings rather than assuming we know who they are, and then together coming up with a set of initial steps they can take. So what is this about? The healthcare provider understanding the patient's individual situation. So what we are trying to do, we are trying to learn where the patient is coming from, what they want, what help, and helping them lead toward the positive behavioral changes. Then open up about their feelings. So these kind of things. It's about the healthcare provider understanding the patient's individual situation, where they come from, what their individual situation. So option C is your answer. We cannot see them talking about utilizing well-established practices in patient contact. Nowhere we can see anything related to well-established practices. So option A is eliminated. Option B, taking charge of the patient's changes to a patient's behavior. We cannot see them saying that the health provider has to take charge of it. So I'll show you the answers once again. 37B, 38A, 39B, 40C, 41A, 42C. Okay, I hope you were able to do it. If some parts were not clear, you can listen to this audio once again. You can try it once again, or you can listen to the explanation as well. And if there are any parts that you missed in the audio that's not related to the answer, you can also refer that from the audio script. So I hope it was helpful, and I hope you could all write the answers for it. And we will see again in another live, which will be on next Wednesday at 8 p.m. Until then, bye-bye, take care, and good night.